feedbacks or suggestions. I'll be happy to answer your queries. Okay, so we all know that MRI shows us anatomy in great detail. Yeah, so MRI can tell us the anatomical structures and everything, but why do we say it a term called functional imaging? This is because of the part of the brain which is seen in the imaging. That is how does your brain think, how does it feels, and what are the structures which are moving at a given moment. So all these things you can see in the functional imaging. So this is exactly what functional imaging aims to do. So in this session I'll introduce you to the fundamentals of functional MRI, how it works and why it matters. Okay. uh, So traditional MRI shows us all the structures, but functional MRI shows us life in action. If I can elaborate in a sentence. Okay. So from mapping brain activity to guiding surgeries, functional imaging has revolutionized how we understand the human brain. So in order to understand the human brain and what is happening inside the brain, what life does in action, everything can be seen through the functional imaging. So first I'll be discussing about the diffusion weighted imaging. Then we'll move ahead to perfusion. Uh, then we'll be discussing a little about bold sequences, which is fMRI, and a bit about spectroscopy. Okay. So, of course, when we talk about functional imaging sequences allows unlimited range of applications. Okay. Basically, conventional imaging sequences has a problem that they are slower and they take time to be acquired, but functional imaging sequences are ultra fast imaging sequences, and that is why collectively all these ultra fast imaging sequences are known as functional imaging. Why? Because they allow you to assess the function of the brain and the physiology of the brain. So that is why I said that it shows us life in action. Okay. So applications I'll be covering in today's session will be DWI, perfusion, and spectroscopy, along with some parts of bolt sequence. So before I start with diffusion weighted imaging, can someone tell me what is diffusion? Yes, am I audible?
Ma'am, the movement of water from a high concentration gradient to from the movement of higher or lower concentration gradient.
Great. So all of you might have studied in your school also this thing कि diffusion basically is the movement of molecules. Okay, जो भी movement है आपका extracellular space से due to the random thermal motion, that is known as your diffusion. So you can see in this picture also. Okay, there are two pictures in this. In first image you can see that molecules are freely diffusing. Okay, and in the next image you can see, which is at the bottom, that the molecules are restricted. Okay, so why it is restricted, that may be because of some ligaments, because of some macromolecules, because of some membranes. So that is why you can see now the ones which are diffusing in the first image, right? They had do you see that they have any direction? Are they directional in the first image?
No, ma'am.
No, ma'am.
Okay.
Randomly accessed.
Yes, randomly. And the next image, you can see clearly that they all have a direction. So they are directional depending on the structure of the tissues. And the second thing is it is restricted because of some pathology, or because of some macromolecule, or because of some ligaments. Okay, so this net displacement of the molecules, which you are seeing in both the images, that diffuses across an tissue. Okay, and how it diffuses per second is known as your apparent diffusion coefficient, which we all say ADC. You might have heard, if you were posted in MRI. ADC, what do you mean by ADC? So this is ADC is nothing but your net displacement of this molecule, okay, per second. That the molecules are displaced across any area of the tissue per second is known as your apparent diffusion coefficient. Okay, so what happens in the area of the restricted diffusion? Okay, if the area is restricted, with diffusion is restricted in any particular area, ADC will be low. Please listen to what I am saying very carefully, that the areas where the diffusion is restricted, ADC will be low, whereas in the first image where the diffusion is free, molecules are moving freely, the ADC will be higher. Okay, so in the areas where the molecules are restricted, ADC will be lower, and in the areas where the molecules are moving fastly, moving in the free diffusion, the ADC will be higher. So in order to sensitize this, we apply gradients, okay, on either side of it to see the difference. So we have discussed this. So how we'll apply this gradient? What happens? What happens in spin echo and what happens in gradient echo? Can anyone tell me this? What happens in spin echo and what happens in gradient echo? Or just tell me what you mean by spin echo and what do you mean by gradient echo? Because unless you are
Ma'am,
clear, yeah.
in spin echo, we use 90-degree and 180-degree inversion pulses we use. And
Okay.
in gradients, we use flip angle.
Flip angle, which is variable flip angle
Less
excitation
than
pulse.
60 degree.
Sorry?
And in diffusion sequences, we can use deep angle up to 60 degree.
Okay, that is great. I'm just asking what do you mean by gradient echo? Like how she said, 90-degree and 180-degree is the spin echo sequence. Now, what do you mean by gradient echo? In gradient echo, gradient is only applied for rephasing, right? There is no specific 180-degree rephasing pulse. You all are aware of it. That is when we apply excitation pulse with variable flip angle excitation pulse, okay, 10 to 110 degrees. And in spin echo sequence, we apply a fixed 90-degree excitation pulse, whereas in gradient, we apply variable flip angle excitation pulse followed by the gradient rephasing. So what happens indeed in diffusion weighted imaging, we'll be applying spin echo sequences where the gradients will be applied on either side of 180-degree rephasing pulse, okay, so that they can sensitize the sequence and they can apply changes in the diffusion. So that is why these are known as your ultra fast imaging sequence, because we'll apply here SSSE EPI. Now, can anyone tell me what is the full form of this? SS is single shot. Okay, so single shot spin echo. This is a type of spin echo sequence, which is EPI is your ecoplanar imaging. Okay, so that can be single shot or we can also apply multi-shot. So this is a kind of imaging sequence where the acquiring the image is faster compared to the conventional spin echo sequence, and we also apply EPI, which itself make it ultra fast. So what happens that diffusion will apply change. How we'll apply this gradient on both the sides of 180-degree rephasing pulse, and this is not because the motion happens particularly quickly. Okay, so we need to reduce other types of motion also, right? Such as flow motion is also there, and diffusion of the motion from the diffusion is also there. So in order to reduce other types of motion also, we need to we need to put this sequence on that particular diffusion type. So typically we can use single or multi-shot spin echo with ecoplanar imaging to acquire the images in the few seconds. So how we'll acquire this? At first we saw what is diffusion, okay, in the image. So we saw that the areas which you are seeing freely diffused molecule, in that the ADC was low or high in the areas of free diffusion. The ADC was low or high?
ADC is high.
High.
Yes, the ADC is high, okay.
High.
Yes, ma'am.
And the areas of restricted diffusion, the ADC
ADS
is
is
low.
low.
Yeah,
Lower.
yeah, that's what we saw. And in that we discussed that how we can acquire this by applying a 180-degree rephasing pulse on either side, right? So there are two types of diffusion weighted images in this. First is your diffusion or trace image, and next is your ADC maps. Now two types of images are generated if you are acquiring this thing, diffusion weighted imaging in MRI. Okay, now let's understand both the images, how we acquire both images, and how ADC will appear in both. So we have seen that the areas which are restricted in diffusion, they have low ADC because of the restricted molecules. And areas where molecules are freely diffusing, in that ADC is higher because molecules are freely diffusing. So what happens in your trace images or diffusion images, that damaged tissue that has restricted diffusion, that is ADC will be lower, right? So they will appear brighter. Which areas? The areas which are damaged and where diffusion is restricted. So in those areas will appear brighter than the normal tissue. But because the area which has diffusion, in which the molecules are moving freely, they will have high ADC. Why? Because this is because the spin is restricted. They will be refocused in the areas which are restricted diffusion. So as they will stay in the place during the applications of both the gradients whenever you are applying 180-degree rephasing pulse. But in normal tissue, which does not have any damage part, which they are considered as normal, their diffusion will be random. So signal will be lost. Why? Because no signals will be there to be refocused, and that is why they will cancel each other, like how we have seen the 90-degree excitation pulse is applied, 180-degree rephasing pulse is applied, and then they cancel each other, and again excitation pulse is applied. So that is why those areas will appear normal compared to the areas which are abnormal, and areas will be appearing brighter because ADC is lower and signals will be refocused in them. That is why they will be appearing for both the applications of the gradient, and they make the areas brighter compared to the normal tissue. So this is your diffusion or trace image. Now if we talk about ADC, ADC is nothing but actually this is a post-processing technique, you can say, where we calculate the ADC, right, which is apparent diffusion coefficient for each voxel. We have a voxel, right, for each part. So for each voxel of the tissue, ADC is generated. Apparent diffusion coefficient for each voxel of the tissue is generated. How? We allocate a signal intensity. Okay, what value we are getting? Suppose we are getting a particular value, particular ADC value for this voxel of the tissue. So according to that volume, we'll allocate a signal intensity according to its value. Okay, so therefore the restricted tissue which has low ADC, that will appear darker than free diffusing areas which have high ADC. Understood? What did I say? ADC maps, these are your post processing technique, that how we calculate ADC, that is apparent diffusion coefficient, by applying a particular signal intensity volume according to the apparent diffusion coefficient value. Like each voxel will have a ADC value, and according to its value, we'll allocate a signal intensity, like it is appearing brighter, it is appearing darker according to its value. So how it will be generated ADC? The areas which will be having restricted tissue, those areas will have low ADC. Okay, compared to the areas which have freely diffusing molecules, those will be appearing brighter. So this is how your normal tissues and your abnormal tissues will be differentiated, and two types of diffusion weighted images will be generated. That is your diffusion and ADC map. Now, do you all have any doubt in this? Should I repeat again, or is it clear?
Ma'am, diffusion and trace images.
बेटा आप फिर से बोलोगे, आवाज नहीं आ रही है आपकी.
डिफ्यूजन एक बार रिपीट कर देंगे आप?
हाँ बिल्कुल. डिफ्यूजन या ट्रेस इमेज जो होती है, बेसिकली क्या होता है कि डैमेज्ड टिश्यू जो है, डैमेज टिश्यू में हम सब ने देखा कि मॉलिक्यूल्स जो है वो रेस्ट्रिक्टेड है. रेस्ट्रिक्टेड डिफ्यूजन मतलब कि जो एक्स्ट्रा सेल्यूलर स्पेस से फ्री होते हैं, फ्रीली पास ऑन होते हैं, वो फ्री नहीं हो जाते, वो एक जगह पे पर्टिकुलर डायरेक्शन में डिफ्यूजन उनका रेस्ट्रिक्ट हो जाता है. ठीक है, तो जो पहला इमेज बनेगा डिफ्यूजन या ट्रेस इमेज जिसको बोलते हो, वो
Excuse me, ma'am.
yes.
I'm from Bangladesh. Actually, I don't know.
Okay.
Hindi.
I'll be speaking in both the languages because there are some students who are comfortable in Hindi also. So please don't worry. I'll be explaining in both the languages. Okay.
Thank you. Thank
So
you.
diffusion or trace images basically, where the first part is we have seen that diffusion was defined as any movement of molecules from the extracellular space. Right. So we have seen that in areas where molecules were freely diffusing, in those areas, the ADC is higher. But in the areas where the diffusion was restricted, in those areas, ADC is lower. Okay. So the two types of diffusion weighted images will be generated. First will be diffusion or trace image. So in this, what happens is the area which will be damaged, they will have a restricted diffusion. Okay. And they will have low ADC. So they will start appearing brighter compared to the normal tissue which has diffusion is higher, but the diffusion is free and ADC is higher. You are understanding? It is not like because ADC is high, so the area will also appear bright. No, ADC is high. Why? Because the diffusion is free. So that is why ADC is high. But the areas which are damaged, the areas which are having damaged tissue, they will have restricted diffusion and they will have low ADC. That is why the areas will be appearing brighter on the image. Okay. Now, why it will be brighter on the image? Because the spins will be available for refocusing. Why it will be available for refocusing? Because we have seen that when we apply 90 degree and 180 degree, what happens? The signals cancel out each other in the normal areas, right? But if the areas are not normal, if the areas are restricted, if the areas are having damaged tissue, these things will be refocused. Okay, so these spins will be refocused as they stay in the same place during the application of both the gradients, whether we apply 180 degree rephasing pulse from on either side, right? So this will generate your diffusion or trace image. Now in ADC, what happens? ADC is your post-processing technique. So in this, ADC value is calculated. How it is calculated? For each voxel of the tissue. For each voxel of the tissue, ADC value is calculated depending on the signal intensity, okay, according to its value. So if a particular damaged tissue has a value, suppose like 20, I'm just giving an example, okay, ADC value 20, and of that particular voxel, the voxel of the tissue, the value of ADC was calculated as 20. So according to that 20, that signal intensity value will be calculated. Okay, automatically it will be calculated by your post-processing technique, which is available in your MRI machine. You can see the ADC map after the diffusion weighted imaging is acquired on your MRI. Okay, so according to its value, that signal intensity value will be seen in your ADC map. So whenever the tissue will be having damaged tissue or restricted diffusion in which we see ADC as lower, so those areas will be appearing as darker. In first part what was happening? Areas which were damaged were appearing as brighter, but in ADC, the areas which are damaged, they will be appearing as darker. Okay, and then the areas which are free and the ADC is higher. So that is why these will be the contrast which is seen on the trace image and which will be seen on the ADC map. Is it clear?
Yes,
Yes,
ma'am.
ma'am.
Okay, so you can see the image here. Some parts are appearing as brighter and some parts are appearing as darker. So this is your diffusion or trace image in which the areas which are damaged, okay, they will have a restricted diffusion and they will be appearing brighter. All those brighter areas will be appearing on the image, but this will be having low ADC. If we talk about ADC, that is apparent diffusion coefficient. When we'll generate ADC for this image, what will happen? For each particular part of the voxel of the tissue, a value will be generated depending on this intensity, what you are seeing in the image. So the areas which will be damaged, they will appear darker, okay, in the ADC map. And the areas which are appearing normal, they will have brighter ADC. Okay, so this is what happens in your diffusion weighted imaging. And if I talk about the uses, where is it is used, it is mostly it is important in infarction. Now, can anyone tell me what do you mean by infarction, or should I tell you like what is ischemia, what is infarction? Ischemia is basically what happens whenever that is decreased blood supply happens, and
Yes,
because of, yes, and
yes, ma'am.
infarction
Blood
is,
supply, when the
hmm,
blood supply are restricted,
hmm,
so the brain tissues are damaged, and
yes.
after certain time, it got necrosis also.
Okay, very good. So this is what happens in ischemia and infarction. So
Yes,
most common usage of diffusion weighted imaging is in the brain after infarction. So what happens whenever stroke happens, that is early stroke, we need to know that what time the onset of the ischemia happened. Okay, but this is important before the tissues are permanently damaged, right? So these diffusion weighted imaging is very much important in those things, that areas will start appearing brighter on the trace images, and it can be seen within minutes of infarction. Like when the stroke happened or infarction happened, you can clearly see, because all those area will start appearing brighter on your diffusion weighted imaging sequences. Okay, so it will show all your irreversible and reversible lesions, like which are permanently damaged or which can be reversed, all those things, or what happens after stroke, early onset, also the changes can be seen and various treatment can be planned. So this is very beneficial in all those cases. And it is also used to differentiate between malignant and benign lesions, that which lesions are benign and which lesions have cancerous cell and which lesion does not have cancerous cell or tumor, or whether it is edema or whether it is infarction. All those things can be seen through the diffusion weighted imaging. So whether you talk about white matter in the brain, okay, which is difficult to be seen in other conventional imaging sequences, all those things can be seen in your diffusion weighted imaging, right? So let's move ahead to the next functional imaging, which is known as your perfusion. I understand that these topics are difficult and it is not easy to understand all these things in one class, but I'm telling you, you'll get a brief idea for sure what happens in perfusion, diffusion, and then you can read out later, and you can connect with me also in, even after this seminar, and I'll be happy to answer any of your queries. Okay, so perfusion, you can see here. Now, what do you mean by perfusion? Perfusion is basically, you can see the definition here, that it is a regional blood flow in tissues, and it is defined as volume of blood that flows into 1 gram of tissue. So because we all know that MRI is, does MRI have, of course you must be you all must be aware about these things, but MRI we use, what is the basic principle of MRI? I should have started with this, but just tell me what is the basic principle of MRI?
NMR.
Yes, but what happens in that?
Ma'am, it is
Briefly, you can tell me.
Ma'am, alignment of tissues in particular
basically
magnetic field.
Okay. Anyone else?
it is the principle of the hydrogen atoms, which are linearly
Hmm.
when when we place a patient
Hmm.
towards a MRI scanner,
Hmm.
so the external magnetic field
Hmm.
it it uh,
Yes. What happens is because of
the
the
hydrogen atoms are random. They are
alignment.
randomly in alignment. So
Hmm.
after the external magnetic field,
Hmm.
it are in a linear formation. So
Hmm.
when after that, when we applied the RF pulse or radio frequency pulses,
Hmm.
uh, then the we generate or we uh, what is this called, ma'am? Uh,
Yes, what happens is when the patient goes inside, all those spins are aligned according to the energy, and when the RF pulse is applied, they start losing energy and they start joining the high energy population, and that's how net magnetization vector starts decreases, and then they starts to wobble with a particular frequency which is given by the Larmor equation. All those things are there. I just wanted to know that you all have a brief idea or not. Okay, very good. You all are aware of this, and
yes, ma'am.
it is important, okay, because unless you are clear with the basic principle, which I tell in all my classes, that if you know the basic principle, you can read MRI very clearly and very nicely. You'll love it. But if you're not clear with the basic principle, you will not understand functional or anything, because in each sentence, even if you see in the textbooks, even if you see in the articles, research articles also, they mention a word. Now you have to refer all those things from the basic principle, from the encoding, from the sequences, okay, spin echo sequences, gradient echo sequences. So whatever that has a flow. So unless you are clear with the flow, you will not understand this. So if any of you have not studied the basic principle, you have not studied the sequences, before reading this or before listening to this, you go and you can refer once more what happens in basic principle and your other aspects of the sequences. So I don't have time to cover all those things. We'll be continuing with our perfusion imaging. So perfusion imaging, because there is no radiation in MRI, so but we require very much high spatial and temporal resolution, okay, to see the anatomical information. So that is why the functional imaging comes into the light, that examines all the blood flow, that examines all what happens inside your brain. So it is the regional blood flow in the tissues, which is defined as the volume of blood that flows into 1 gram of the tissue. So it is the measure of the quality of vascular supply to a tissue. Okay. And since vascular supply and metabolism are usually related, so perfusion, what happens? Perfusion measures the tissue activity, right? Now, what do you mean by blood flow? I'll just give you an example. Uh, if you're sitting at a place, okay, and if you're calm, quiet, your the blood is flowing normally. But once you start running, once you start doing an activity, that blood flow increases, okay, because it is uh, like your brain starts monitoring all those activity. So that is why the blood flow increases. And perfusion imaging is the imaging which will measure what happened when you were sitting quietly and what happened when you are running or you are doing an activity. So it shows the quality of the vascular supply. So what vascular supply happened to that tissue when the movement was happening, and how the perfusion images were generated. So this is measured using MRI by tagging the water in arterial blood during image acquisition. So in this, the blood is only used to see the whole thing. Okay, there is no contrast, there is no extra things which we give to see the perfusion. But to measure the tissue activity, we do it by the arterial blood and we acquire the image. So what is the technique of acquiring perfusion imaging? This is acquired by giving a bolus injection of the contrast agent, which is gadolinium based contrast agent. So we'll see before what happened, like how I said that blood will only be responsible for this. During injecting the contrast, what happened, and after injecting the contrast, what happened. So bolus injection will be giving intravenously, and we'll be acquiring ultra fast imaging sequences, that is T2 or T2 star acquisitions. Now I would like to know what is T2 and what is T2 star, because unless you are clear with this, you will not understand what is happening. Now tell me what is T2 or what is T2 star. Anyone? No one?
Ma'am, T2 is transverse relaxation time.
Very good. So T2 is spin lattice or spin spin?
Ma'am, it is spin.
Sure. Spin spin. So what do you mean by spin spin?
Spin to spin.
Spin spin is between spin spin, right? So energy exchange is between both the spins. And spin lattice is, spin is energy, they are exchanging the energy with the environment. So what is happening in T2 star? Why it is known as T2 star? Because it is creating a delay signal, which is known as FID signal. That effect is known as T2 star effect, but what is happening is because of the free induction decay signal, FID signal. So that is why we see that T2 star effect. Okay, so this is your T2 or T2 star effect will be generated. So I started that perfusion will be measured by tagging the water molecules in the arterial blood during your image acquisition. Now, how this tagging will be done? Tagging will be done either by the bolus injection of the contrast agent or by saturating the protons, which we'll see in the other techniques in arterial blood with RF inversion or saturating pulses. We have seen in other sequences also that when you might be studying all these sequence wala chapter, ki how we saturate a particular signal. That time we put inverting pulse, 180-degree pulse, so that the signals get inverted and saturated. Suppose if we want to get a signal only from water, so we'll saturate signals from fat, right? And if we want signals from fat, we'll saturate signals from water. So how do we do that? We put the RF inversion pulse, or we saturate those pulse so that we get signals only from water, or we get signals only from fat. So what happens ki in through both the techniques that you are seeing, we will acquire the perfusion weighted imaging. So in the simplest form, if I say, it can be acquired with the ultra fast acquisitions before, during, and after the bolus injection of the contrast media. Okay. We also acquire perfusion with the breath hold sequence. Okay. So breath hold sequence is also there to acquire the perfusion weighted imaging. Clear? So you are seeing this first technique, that is before, during, and after a bolus injection of the IV contrast media. So in this, fast imaging sequence is required. So that is why which sequence we'll use? We'll use ultra fast incoherent gradient echoes at the breath hold time and at the same slice location. Now, what do you mean by same slice location? What are the types of encoding?
Phase encoding and
And
frequency.
phase encoding and frequency encoding.
Phase
Phase
encoding or
encoding and
frequency
frequency.
encoding. That is, phase encoding will be in which direction?
That ma'am, vertically, longitudinal,
Okay, and frequency?
it horizontally.
So that only if we are doing it in the same slice selection, that means same slice location, that means if we are using frequency encoding, it should be in frequency encoding direction. If we are using phase encoding, it should be in the phase encoding direction. So we need ultra fast imaging sequence. Now, can anyone differentiate coherent and incoherent? Why it is known as coherent and why it is known as incoherent? Gradient echoes, I have already explained that in that variable flip angle excitation pulse is given as excitation pulse, and we don't use a different rephasing pulse. Their gradient is only used to rephase the spins. So what do you mean by incoherent?
Ma'am,
Ma'am, out of
incongruent no.
phase.
And anyone else? Yes, I think two people were speaking at the same time. I just heard out of phase.
Movement in random direction.
Yes. So what happens is coherent is that all molecules are moving in one phase, right? Like how I had explained in the basic principle also, you will see that hydrogen protons start to wobble in the direction which is given by the Larmor frequency. Okay. So if it is moving in one phase, it is coherent. And if it is moving out of phase, it is incoherent. So we use ultra fast incoherent out of phase echoes during the breath hold sequence at the same slice, at which point when we are giving the contrast, when we were not giving the contrast, and when we have already given a contrast. So before, during, and after we will acquire this sequence. Now what this contrast will do, they will shorten your T1 recovery time. Now what is T1 recovery? There are two magnetization, right? Transverse and longitudinal.
Longitudinal.
So T1 recovery is
Longitudinal.
Longitudinal.
longitudinal matlab kya? What is longitudinal?
When
Recovery
the
I'm asking.
when the
Time.
net magnetization vector are flipped to the longitudinal magnetization, it is longitudinal.
So that is recovery, right? Recovery
Yes,
of,
recovery of the tissues.
that is fine. I'm asking recovery of which magnetization?
Longitudinal
Longitudinal
magnetism.
Longitudinal magnetization to the transverse magnetization, right? So this contrast agent will shorten the T1 recovery time, and the visceral structures will be appearing high perfusion areas as brighter on the T1 weighted fast gradient echoes. Okay, so this is how you will apply, this is how you will see in your perfusion. That first technique is we give perfusion images with the fast scanning acquisition before, during, and after a bolus injection of the IV contrast media, in which gadolinium is injected, and it shortens the T1 recovery time. Once it shortens the T1 recovery time, the structures which are considered as visceral structures, they will start appearing as high perfusion areas as brighter, and they will appear as T1 weighted fast gradient echoes. Okay, in this we can use single shot gradient echo with ecoplanar imaging. So that sequence will work as they will, at first only I had explained that in this you require a good temporal resolution and spatial resolution sequence. So this SSG EPI will be producing your required temporal resolution, and it will measure all the transient change during, before, and after the bolus injection. Okay, and after this injection, you can see this is how your perfusion image is generated. That is pre-gadolinium, GD is your gadolinium, 30 seconds post-gadolinium, and 16 seconds post-gadolinium in this pre-post. And the way radiologist will explain, or the way the radiologist will guide you, that you have to create the image after this much time. In that particular moment, you will be acquiring the images. So you can see these perfusion images are very much important in evaluation of visceral structures such as your kidneys. You can see the kidneys here, liver, and spleen. So what happens after this data acquisition? Okay, after we'll acquire this data, a signal decay curve will be generated. Okay, so this curve will be known as your time intensity curve. Okay, so this time intensity curve, what it will do, this time and intensity, like at what time, as I have shown you, pre, post, and again a later after injecting the contrast media, this will generate at what time, what intensity was acquired. So that curve will be generated, and that will be you can say it as time intensity curve. And this time intensity curve for multiple images will be seen, and once you combine all these images, you will get to see a cerebral blood volume map, which is known as your CBV map. Okay, I'll be explaining all these things. So same things are written in this slide also, that dynamic is when you give the contrast and you acquire the image. So T2 star weighted image will be seen, T2 fast or a fast T2 sequence will be acquired. Yes. Ravi, please mute the rest. And if you're not interested, you can leave the presentation. Okay. So approximately, we give 20 ml of gadolinium-based contrast media. Flow rate we keep at 4 to 6 ml per second. And in that we acquire single shot gradient echo EPI sequence, which is a non-incoherent gradient echo sequence. And whole brain is covered. Okay. And acquisition, just imagine where one sequence is acquired like in 3 minutes, 4 minutes, you have seen, right? But the gradient echo sequences are faster. So to acquire that blood flow, to acquire the faster moving blood, we need to see it ultra fast way. So that is why we use gradient echo sequences, and the sequence will be acquired in just 90 to 120 second acquisition time. Okay, so tissue signal changes will be appearing on T2 star effect, and that will be creating your time intensity curve. I have already explained according to the time how the contrast was appearing, how the intensity was seen. That curve will be generated, known as your time intensity curve. Ravi, whoever this
Ma'am, please turn on your mic.
Ma'am, you're on mute.
am I audible?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
You can only speak if I ask you to do so. Please do not behave like this. It's, you get a very limited chance to listen to these topics, and if you don't take advantage of it, there is no point in listening. Okay, you can leave the chat, or you can leave this group also if you're not interested, and you will be answering only if I ask you to do so. Because once I get distracted, it is very difficult for me also to to start from that same point. The screen is visible?
Yes,
Yes,
ma'am.
ma'am.
Okay. Huh.
Yes,
So
ma'am.
this, after generating this time intensity curve, you will be seeing after combining all these imaging, you will be seeing the cerebral blood flow map, in which you will be seeing this mean transit time, like at what time that intensity started appearing to be different, and how it reached to the peak, which is known as your TTP, time to peak in seconds. Okay, and time to bolus arrival also will be seen, like what time the contrast was injected, how it went out from the kidneys, and what was happening when there was no contrast in your body. So you can see all this map. TTP will be generated. Okay, areas under curve, that is cerebral blood volume map, will be generated. Okay, so if you see an infarct, you can see in that in this thing, I mean the graph, that if it is infarct is there, how the peak is appearing. Okay, and if the areas are normal, how the peaks are appearing. So you can see this thing clearly in the image also, and through this map also. So just I have put this uh, uh, table in which shows that if TTP, CBV and CBF. Now TTP is, what is TTP? What is CBV and what is CBF? TTP is your time to peak.
Time tracer.
CBV is your, yes, time to peak. CBV is your cerebral blood
Cellular
volume,
blood volume.
and CBF is your cerebral
Cerebral blood
blood
flow.
flow.
Yes.
Yes. So you can see if it is normal, all the areas will be appearing a normal peak graph. And if it is like high benign, you can see in the increase, you will be seeing increase in TTP and CBV volume. If it is ischemia, you can see increase in both the TTP and CBV, but CBF will be lowered. So this is the table which I have put, that how the graph will appear in normal case, or if it is having infarction or ischemia. So we have discussed all these things. SSG API sequences will be used. Okay. Now, apart from these two methods, which we are seeing, arterial spin labeling, inversion sequence will be used outside the FOV. I've already discussed this. 180-degree sequence will be applied, and untagged image, that is like two images will be seen. Okay, whether it is arterial labeling and unlabeled image. So labeling image will be acquired, and untagged image will also be acquired as a reference. And after the technique, the reference image will be subtracted from the tagged image. Okay, like this is the technique. So this is how what happens, that first arterial image is extracted, and then a normal image is acquired, which is a control image, and then the tagged image is subtracted from this control image. And how this is how we see the perfusion generated map, whether you see the CBF, which is cerebral blood flow map, and how you see the color coded map after labeled and controlled image are combined, and finally a extracted CBF color map is generated. So this is the technique for perfusion weighted imaging. What are the uses of this? Again, it is used to evaluate ischemia disease. I have told in the beginning only that what happens when your brain is at rest, or what happens when your brain is doing an exercise. All those things can be measured in perfusion imaging. Okay, and all those things will be reflected in your CBV map. That areas which has low perfusion will appear dark, like how it happens in stroke, while the areas which are having higher perfusion, they will be appearing as brighter, like in malignancies or whenever cancer is suspected. Okay, next we'll move ahead to the functional imaging. I'll be discussing it quick. Okay, we'll be just seeing the basic what happens. You might have heard about bold. So we use this thing in functional imaging. It is a rapid MR imaging technique which acquires the images of the brain, again when the brain is at activity or when the brain is at rest. So again, two sets of the images will be generated, subtracted, and functional imaging of the brain activity will be measured according to the blood flow. Okay, so as you are seeing here, when the brain during activity, the blood flow to the cortex will increase, right? whenever the body is doing some activity, there will be increased blood flow to the cortex. So what will happen? That will be causing a drop in your deoxyhemoglobin, okay, which will result in a decrease in dephasing, and again it will be increasing your signal intensity if the spins are dephased. So these effects are very short lived. So we require a rapid sequences like how we have seen EPI, ecoplanar imaging, or the gradient echo sequence, right? So to exploit that, we put T2 star effect also, okay, or bold images also with long T. T is your time of echo. That is the time taken from the, what is T? What is T?
Time of excitation.
Time of excitation. Or
Excitation.
can you define it? What is time of
Echo time.
time of excitation? Are you sure?
Time.
Time of
No, ma'am.
echo.
Echo time.
Anyone else?
Time
The
taken from one
time
signal
when
to another signal received.
It is the time between the 90-degree pulse and the signal received.
Okay. Anyone else?
Ma'am, time from one excitation pulse to the other. RF
Is it
excitation pulse.
T? What you are saying, is it T?
ma'am, the time between 190-degree excitation
Echo.
pulse and the echo generated,
Hmm.
it is called TE. That's
Yes.
called time of echo or time
Yes.
to echo.
Yes. Some students, they have said time taken from one RF pulse to the other RF pulse. That is your, that one thing is TR and one thing is T. What is TR?
Yes.
Time of repetition and
Time
time
of
of
repetition.
echo. Right?
Yes.
Time of repetition is one RF pulse to the other RF
Second
pulse.
article.
Yes. Time of echo is one RF pulse to the time of signal collection.
Significant.
Okay.
Yes,
So this is your T. So what we do in functional MRI, we use this bold sequence. In bold sequence, why? Because it will create a T2 star effect. That is, FID signal will be generated, and in T2 star effect will be generated, and we'll use a long T, that is around 40 to 70 millisecond, and we'll acquire this bold images. Now, in order to understand this bold, let's discuss the magnetic properties of the blood, right? Magnetic properties of the blood are very important in understanding this technique. Now, you all are aware of hemoglobin. What is hemoglobin? Hemoglobin is a molecule that contains iron and transports oxygen in the vascular system, right? Why? Because oxygen directly binds to the iron. So that is your hemoglobin. So when oxygen is bound, when that oxygen is bound, that is known as your oxyhemoglobin. So the magnetic properties of the iron are largely suppressed. But when the oxygen is not bound, that is known as your deoxyhemoglobin, right? So the molecule becomes more magnetic. What did I say? That in the hemoglobin, hemoglobin is a molecule which contains iron. Why? It contains iron and it transports oxygen in the vascular system when the oxygen binds directly to the iron. So this oxygen bound is known as oxyhemoglobin, and the oxygen which is not bound is known as deoxyhemoglobin. Okay, so oxyhemoglobin, in this the iron are largely suppressed, and deoxyhemoglobin, in this the molecule becomes more magnetic. Therefore, oxyhemoglobin is diamagnetic and deoxyhemoglobin is paramagnetic. Now tell me, what is diamagnetic and what is paramagnetic? Anyone? Anyone? Diamagnetic and or paramagnetic?
Diamagnetic, that oppose the magnetic field.
Oppose the magnetic field. What do you mean by this? Good. And paramagnetic? Yes. Attracted or repelled? Just tell me about this thing.
Attracted.
Paramedical and diamagnetic repel.
Again, I could not hear it. Paramagnetic are
Attracted.
and diamagnetic are
Repel.
Repelled.
okay. So these things, what happens that paramagnetic is your deoxyhemoglobin and diamagnetic is your oxyhemoglobin. So paramagnetic deoxyhemoglobin will create an inhomogeneous magnetic field in its surrounding, like in its immediate vicinity. So this inhomogeneous magnetic field will increase your T2 star effect, and that will attenuate your signal from the regions containing the areas which are having deoxyhemoglobin areas. So what happens at rest, this tissue will use a substantial fraction of the blood flowing through the capillaries. So the venous blood will contain almost equal mix of oxy and deoxyhemoglobin. But during exercise, that you are seeing in this image also, that during exercise, when the metabolism is increased, of course, when what happens when we are exercising, we use more metabolism will be increasing and more oxygen will be more oxygen is needed. So more is extracted from the capillaries also. So in muscle tissue, the concentration of oxyhemoglobin in the venous system becomes lower. So the brain, however, is very sensitive to this. When it will become lower, the cerebral vascular system will increase, and that will activate the area of the blood flow where it is increasing. So blood oxygenation increases during brain activity, and if the brain is at rest, it will decrease. So the most important physiological effect that will create this MR signal intensity changes between rest and stimulus is known as your blood oxygenation level dependent, which is your bold sequence. What is the full form? Blood oxygenation level dependent. Why it is known as dependent? Because it depends on the oxyhemoglobin, how it is increasing and how it is decreasing. So this bold sequence will exploit the differences in magnetic susceptibility, right? That in beginning only I said that oxyhemoglobin is diamagnetic, deoxy is paramagnetic. So this bold sequence will exploit that susceptibility. That susceptibility is what? How it is reacting towards magnetism. So that bold sequence will exploit the difference between those as a result of the increased blood flow or little blood flow or increased in local oxygen consumption. Whatever is happening, this will exploit the difference. Why? Because deoxyhemoglobin is paramagnetic. Vessels containing small amount of the molecule will create a local field inhomogeneity. Therefore, because of the inhomogeneity, we all know if the what is inhomogeneity? Inhomogeneity means magnetic field is different at different areas. So because of this local field inhomogeneity, dephasing will occur, and that will lead to your signal loss. So that is what those things are demonstrated through your arrows. Also, you are seeing that if it is in during stimulation, deoxyhemoglobin increases, dephasing increases, and because of the inhomogeneous local field is there, so signal intensity will decrease. And during activity, deoxyhemoglobin decreases because local field inhomogeneity will decrease, dephasing will also decrease, but the signal intensity will improve. So this is what is happening in this graph. So I have explained this, it acquires the brain during activity or stimulus or at rest. Two images will be generated, and then oxyhemoglobin and deoxyhemoglobin will show the increase and decrease in the T2 star effect. That will attenuate your signal. Okay, and you can see the blood flow areas. Like for example, seeing activates the visual cortex, hearing activates the auditory cortex, and finger tapping activates the motor cortex, right? If we are seeing something very carefully, that visual cortex area will be activated. So you can see these things clearly on your perfusion weighted, in your bold sequence, that which area is the signal intensity is higher and which area the signal intensity is lower. So that is known as your blood oxygenation level dependent. So I've just put an image that these areas will be appearing brighter or darker. Okay, in this also we use EPI sequence because we require ultra fast imaging. That is why EPI fast gradient echo will be used and T2 star effect will be used. The clinical applications of bold sequence can be stroke, epilepsy, pain, or any behavioral problem also we see bold sequence or fMRI. You can see in the image areas are
Ma'am, please show that previous image again.
which one?
Previous, yes, ma'am.
This one?
Yes, ma'am.
This image is just about the areas of the motor cortex, olfactory cortex, auditory, like when you hear which cortex is responsible, when you are doing any movement, motor cortex is responsible. Okay, when you are hearing, olfactory cortex, and like all the cortexes you can see here, sensory, visual, those areas will be the signal intensity you can see brighter, like how in this image is there. Cortexes will be showing all those things. Okay, bold images of the brain. You can see here functional areas are appearing in the red part in all the images. Okay, so all these areas will be appearing on your image. Understood.
Thank you,
I
ma'am.
know it is
Yes,
difficult
ma'am.
to understand, but I'm just giving you an idea like what is happening in the functional MRI. We use bold sequence with long T, okay, and we extract the image from the mask image, and then the areas which are activated, that is the areas which has more blood flow, they are seen on the anatomical part of all those things. All those images are highlighted as red, you can see here also, and that will reflect your brain activity. Okay, so let's move ahead to our last topic, which is your MR spectroscopy. So MR spectroscopy, like how the name suggests, spectro means spectrum. Okay, this MR spectroscopy will produce a spectrum opposed to an MR image. Like what you see is a full MR image, but in spectroscopy, this will create a spectrum of a plot of signal intensity versus frequency curve. Okay, that will show your chemical shift. There are different chemicals which will be shifting, and how it is shifting, we'll be seeing that on intensity versus frequency curve. That will show your difference between the different elements. So this chemical shift will be caused by your hydrogen proton that will create in different field strength and different frequency. Okay, so this chemical shift will be measured in your parts per million, which is ppm, and chemical dispersion will occur if the field strength is increasing. And all this, I'll be explaining this, don't worry, I'm just showing you. These will be your chemical shift of all these spectrum you will see in the MR spectroscopy, that will shift from between the intensity and frequency. Okay, so there are two techniques to acquire MR spectroscopy, which is single voxel technique and multi-voxel technique, right? So as you can see on the slide, it is written that the most common nuclei used for MR spectroscopy are hydrogen proton, sodium, and phosphorus. For clinical imaging, so hydrogen proton is used. And of course, this will MR spectroscopy will show you the changes in tumors, in stroke, in epilepsy, or any neurodegenerative diseases. You can see in a proton spectrum of 1.5 Tesla, metabolites are spread out. All these chemicals are known as your metabolites, and they will show your chemical shift, which is measured in your parts per million based on the resonance, like how the protons are vibrating. According to that, chemical shift will be generated, and total signal from all the protons in each voxel will be measured. Okay, if all the signal were used for MR spectroscopy, fat and water will peaks would be huge, and that will show the peak in the metabolites, right? So there are two techniques to acquire spectroscopy: single voxel and multi-voxel. Single voxel means that you are the first image is your single voxel spectroscopy, second image is your multi-voxel spectroscopy. That means we are acquiring this intensity versus frequency curve from a single voxel. And if we talk about multi-voxel, that means we are acquiring this intensity versus frequency from the multiple voxels. Okay, so in single voxel, what will be happening? That means we'll be applying gradients in the three direction, which is X, Y, and Z, and then we'll select a signal from that particular part by the use of crusher field gradient pulses, okay, and which is known as your steam and press. Okay, steam is your stimulated echo acquisition mode, and press is your point resolved spectroscopy spin echo, which you might have heard in your spin echo sequence part also. Okay, so single voxel technique will use this three intersecting slice, like how I have shown you here, to locate a single voxel, right? X, Y, and Z. There are three intersecting slices. You can see green, black, and red, right? From a particular voxel, and that will intersect, and that will generate a single voxel to show the spectrum. So two techniques are your: first is stimulated echo acquisition mode. In this, what is happening? You are seeing 90 degree, 90 degree, 90 degree, and stimulated echo. Okay, so these protons are located in a cuboid shaped voxel, right? These all protons that you can see X, Y, Z intersecting slices, these are located in your cuboid shaped voxel where these three planes overlap. And this steam technique, which is stimulated echo acquisition mode, this will this will be achieved by shorter echo times, but the expand, of course, signal to noise ratio will be more, and the time of appearance of the stimulated echo acquisition time will be depending on the spacing of these three RF pulses. So how we'll acquire this? We'll be giving 390-degree excitation pulse, and then stimulated echo will be showing as your difference in the spectrum of this curve. So that is why it is known as your stimulated echo acquisition mode. Second technique is your point resolved spectroscopy. In this, you can see in the graph also how we acquire this. This is not request. Actually, we said that single voxel technique, there are two techniques, steam and press. But press is not only restricted to single voxel. Okay, it can be also used with phase encoding direction. Okay, like how we have seen in chemical shift imaging, where also we'll be acquiring this in from the multiple voxels. So we can also acquire this from multiple voxel. We can also acquire from single voxel. So in this, at time t, spin echo is derived only from the protons that have experienced all three RF pulses. So what is happening? First is 90-degree excitation pulse followed by 180-degree rephasing pulse. Again, a 180-degree rephasing pulse is given, which is generating your press echo point resolved spectroscopy echo. So it is a limitation of its minimal achievable T. So what there was a limitation that at limited T time it was difficult to acquire a sequence. So this is the limitation that it will acquire in the minimum T also. Okay. These are the parameters: short T of 30 milliseconds, okay, and long T2 relaxation time. So the parameters must be clear. Of course, it is given in the MRI machine, but if you are clear, you can also modify, or you can also show in according to the path desired. So this is how your images will be generated. In this, you can see acetyl aspartate, lactate, right? This is CR is your creatinine, okay? CHO is your choline, Na is your N-acetyl aspartate. So these are all your markers which will be showing the effect, which will be showing how the protons are resonating, how it is showing difference between the intensity and time. So all these are your graphs. Now, next technique is your multi-voxel chemical shift imaging. Now, those two are single voxel. There's next is your multi-voxel. Multi-voxel is usually more time consuming because we are acquiring it for the multiple voxels, right? So to measure multiple voxel, of course, it will simultaneously, it will require more time, but it has two potential advantages over single voxel. That is, it can cover a large area, and of course, it will have a high spatial resolution because it is acquiring large area. So this will have the capability of differentiating the surrounding structures and will show the clear image. But there are some disadvantages, of course. Imaging time will be more, and this will have a low signal to noise ratio, of course, and because of the smaller size, it sometimes it will be critical and sometimes it will be difficult to evaluate the smaller organs like a prostate, where a single voxel is impractical. Okay, so these are your spectra which you are seeing in the tissue. These are your markers which will be appearing in the spectroscopy graph. You can see all these spectrum of different molecules, and this is how they will show in the normal spectroscopy image. Okay. So NAA is your N-acetyl aspartate. Okay. LAC is your lactate. CHO is your choline. CR is your creatinine. Lipids is LIP. Okay. INS is your myoinositol, and GLX is your glutamine glutamate. So this all graph shows your chemical shift, how the molecules are showing your intensity, different intensity at different time. So you can see in this graph. So this is a normal spectroscopy image, but if the stroke happens, how this normal spectroscopy starts changing, like how it is happening in 16 hours, 3 days, 1 week, 3 weeks, 6 weeks. So that time also this functional imaging is done in order to see the functional activity. So see the graph. You can see lots of up and downs. It is neurocysticercosis. All the spectrum are disturbed in this. This is glioma. You can see a large swelling in the part of the brain. I've shown in the image. Choline, creatinine, Na, everything is like abnormal levels are there. So it can be clearly shown on the image. This is infection. Infection is there was an abscess in the brain. Okay. And because of that, all these values are increased and it has reached to its peak. Now, how these are the indicators. Okay. If Na drops, that will indicate your tumor. If choline is elevated, that will show that your tumor growth is increased. If the lactate is changed, that will show your anaerobic status, like there is no oxygen supply. Okay. If there is lipid elevation, that will show your tumor necrosis. That means tumor is necrotized. So all these values are important in spectroscopy. So two techniques we have seen, multi-voxel and single voxel. In single voxel, we saw stimulated echo acquisition mode, and point resolved spectroscopy, which can be also done for multi-voxel. Okay. And we saw the indicators. So where do we use this MR spectroscopy? We can be using this MR spectroscopy to plan a therapy, okay? Or we can also use this in conjunction with normal MRI. We can also use for biopsy guidance or any prognosis of any disease, okay? Or if any therapy is happening, if that therapy is working or not, we can use MR spectroscopy for monitoring also. So all these tumor ka staging or any stroke or any, it can be also used for prostate or breast. Okay, so whatever diagnosis is there, or if we have to plan any treatment for all those things, MR spectroscopy is useful. So that's all in today's session. I guess we took a longer, more than 1 hour I took, but if you have any doubt, I'll be happy to answer.